Hello students, today we will discuss interior of right atrium. Okay, this is right atrium, this is right ventricle and this is left ventricle. Interior of right atrium we can divide into two parts by rough anterior part, that is the atrium proper, and smooth posterior part. The margin of this division is lined by the crista terminalis. You can see this is the smooth elevation, this is crista terminalis. Okay, the comb like structure passing from crista terminalis, these are called as musculi pectinati. They form the atrium proper, these are musculi pectinati. The network of these musculi pectinati are present on the right auricle. See, right auricle, you can see here network. So most of the thrombus or losses most often in the right auricle because network of musculi pectinati are present here. So this is right atrium rough anterior part, that is called as atrium proper. Now we'll move on the smooth posterior part. You can see here, this is the smooth posterior part. In this part we can appreciate some openings. So first we will see the opening of superior vena cava. See, this is the opening of superior vena cava. Then this is the opening of inferior vena cava. Superior vena cava, inferior vena cava. Now we will see the opening of coronary sinus. See, blood thrombus is present in, here is the opening of coronary sinus. Now we can see the opening of tricuspid valve. See, one cusp, second, two cusp and three cusp. Opening of tricuspid valve. This opening tricuspid valve is a communication between the right atrium and the right ventricle. See, this is the communication between right atrium and the right ventricle. You can appreciate chordae tendineae also. Detailed video of interior or right ventricle we will discuss later. Now again come to the interior of right atrium. We will see musculi pectinati. So we completed atrium proper, that is the rough anterior part. Now smooth posterior part, already we completed the opening of coronary sinus, opening of superior vena cava, opening of inferior vena cava and opening of tricuspid valve. In addition to this, there are small opening which are opening of, you can see 1, 2, 3. These are the small opening of Thebesian valve, Thebesian vein. Okay. So these are the opening present in right atrium. In addition to these openings, some important structure you have heard. This is the intervenous tubercle. This tubercle, this is superior vena cava opening. Just beneath this tubercle is called as intervenous tubercle. Okay. Here you can see this is the arch of aorta. Because of this arch of aorta, this elevation is present. This is called as torus aorticus. Torus aorticus. Okay. Because of arch of aorta, this elevation is called as torus aorticus. Now come here. You will appreciate. This is the IVC, opening of inferior vena cava. You can see this is called as fossa ovalis. This is fossa ovalis. The margin of this fossa ovalis is called as limbus fossa ovalis. Limbus fossa ovalis. The margin of this fossa ovalis is called as limbus fossa ovalis. Now come to here. We can see Cox triangle. Cox triangle is a triangle which marks the beneath this AV node is present. So boundary of Cox triangle is, you can see this is the tendon of Todaro. This is called as tendon of Todaro. Anteriorly it is present tendon of Todaro. You can see this is the opening of coronary sinus and another boundary is marked by the opening of tricuspid valve. So this triangle is formed. This triangle is called as Cox triangle. Beneath this triangle, AV node opening is present.